Welcome back to my series on your oral health in your retirement years. I'm Dr. Laura Fashier. I treat adults in Marion, Iowa. Today, I'm going to talk to you about some surgical implications. There are three very important things that every senior should know about surgery when it pertains to their oral health. Number one, what is a bisphosphonate and why is it important to your oral health? Number two, why is having healthy gums important to establish before you have surgery? And number three, why do you sometimes need to take antibiotics when you see the dentist after you have surgery? Okay, number one, who here knows what a bisphosphonate is? Raise your hand. It's a common drug that especially women in their retirement years are on, but there are men who are on bisphosphonates as well. Prolia is an example of a bisphosphonate. And they're commonly taken to help people with their osteoporosis. Well, there is an issue with bisphosphonates, and that is after someone has been on bisphosphonate, especially if it's on an injectable kind, less so with the oral, but still a risk. If you have a tooth extracted while you are actively on a bisphosphonate or just after, you might get a hole in your jaw that stays dead and a hole forever. It's called osteonecrosis of the jaw, and being on a bisphosphonate is a risk for that. So anytime someone says, we need to take a tooth out on you, you want to ask yourself, am I on a bisphosphonate right now? Do I need to talk to my surgeon or my dentist about this? That is subject number one. Number two, gum health prior to surgery. Okay, so we have all these different species of bacteria that live right around our gums and our teeth. And if you think about the bacteria from a survivalist standpoint, for the bacteria to survive, they need to be able to stick to the side of your tooth. It's like they're hanging off of a cliff. If they come off of your tooth, they will die. So it's a survival thing for them. They're really good at being sticky. Well, if you go to have a surgery and you have undiagnosed, untreated gum health problems, then those types of bacteria are living in your gums. And you have a higher risk of having those sticky bacteria stick to things like artificial heart valves, artificial joints, other things that we put inside the body, hoping that they're going to stay sterile once we close it all up. So prior to a surgery, you can ask yourself, have I seen a dentist recently? Have I gotten a tooth cleaning recently? And what was the report back from my hygienist and my dentist at that appointment? Number three, antibiotics after a joint replacement. So after some joint replacements, they're usually the weight-bearing kind, your surgeon will recommend that you take an antibiotic before you get your teeth cleaned or have anything done at the dentist that has to do with getting down into your gums. Same reason, sticky bacteria. We don't want the sticky bacteria finding a way into your gums during the treatment at the dentist and then finding a way to that artificial heart valve or artificial joint and getting lodged in there and causing an infection. Thanks for listening. See my next one soon. Today I'm going to talk to you about 7 signs, and some of these are going to surprise you, that show you your dentist is honest and cares about you. Okay, here we go. I'm Dr. Laura Fashier. I'm a dentist in Marion, Iowa, and I treat adults. So I'm going to go through this list and let's see how many of these are surprising to you. And feel free to ask questions in the comments. Number one, this one's pretty obvious. You come in as a new patient and they sit down and talk to you. You are not just a number, you are a person. You are a head with teeth that is connected to the rest of a body, and they have shown you the respect of getting to know you. Number two, this is related, but not exactly the same. They ask you what is important to you, because a dentist can have their own agenda, but in the end, I consider myself a servant of the people who come to me with their questions and with their problems. And my agenda is secondary, and I recognize that. Number 3, this is a great one. You can watch as you're observing as a new or a newish patient. Their team members look happy and they're acting helpful. They're making sure you're comfortable. They're talking to each other in ways that you can tell there is psychological safety in the office. You can tell that they're relaxed. They're there. They're having a good time. They're having fun. If your team members are having fun, it is a very good sign that your dentist is honest and cares about you. Number 4, this one might surprise you. Sometimes when you call, they're closed on vacation. Believe it or not, this is an important one. Dentistry is intense on the body and in our emotions, and we need a break. And you know what? Our employees need a break too. And when you see that the dentist is taking that time and giving that time to their team as well, you know you're in somewhere that's honest and that really cares about their people. Number 5. This one, this might surprise you too. But if they admit that they don't know what your insurance is going to cover, they're honest. Because the God's honest truth is that they don't. You can even get a pre-authorization from an insurance company, a dental insurance company, and it'll say at the very bottom, this is not a guarantee of payment. And besides that, there's all kinds of things that insurance companies do to try to protect their own bottom line, respect for their business model. But any dentist that is worth their weight and who is honest will admit to you they're not quite sure what your dental insurance is going to cover. Number 6, this one might surprise you too. They are not in network with all insurances. If you go to a place and they say, yes, we take all insurances, then it's more likely, I'm not saying it is, but it's more likely that you are in a money grab situation. And number 7, finally, this one's important too. Sometimes your dentist says, I'm going to refer you to a specialist for that procedure, because I'm going to tell you right now, the number of things that a general dentist can do in their practice and the variety of procedures is enormous. We can't all be really, really good at all of them. So when a dentist realizes that there is something that they are not that good at, and they ask you to see a specialist for that, they're giving up some revenue for that. It's because they care. Thank you, everyone. Many of my patients who are over 65, especially I would say the ones who are over 80, when they were children back in the day, the dentist charged extra to have a numb tooth before the dentist would work on a tooth. And so many of my patients were introduced to dentistry at a time when they were a child, didn't have choices, options, because they were under the care of their their parents, and they had painful experiences which caused trauma in their bodies. A trauma that stays in your body like that, it's going to be with you the rest of your life. And many of these patients come to me, and it could be a 60-year-old memory. And as they're telling me about it, there are tears in their eyes. This is a real emotional reaction to thinking about the pain and the non-consent that was involved when they were children. And this is something that I want to address today. I'm Dr. Laura Fauchier. I treat adults in Marion, Iowa, and we're talking today about trauma. I have many nervous patients, and most of them at some point already had a bad experience. Either they couldn't get numb, or their parents didn't pay for the Novocaine because they were young and it was back in the day when dentistry was different. And I want you to know that you are not alone. It's very common, and modern dentistry has changed. I have so many patients who came to me like that and who now have been with me enough times that they know they are safe. It's decreased the amount of trauma response that they get when they come to the dentist. So there is hope for you. You can come and see me if you want, or you can look up and see on your local Google reviews who has kind of a special knack for the nervous patients. Let's talk about Medicare dental plans. This is a new thing, and I want to bring some light to this topic today. I'm Dr. Laura Fashier. I treat adults in Marion, Iowa, and many of my patients are coming to me for the first time with Medicare dental coverage. And how exciting is that? They come in so happy and excited, but also confused. And there's a reason for that. This is kind of a new thing that their Medicare supplement plan comes with a dental plan. And I'm going to be honest with you, there are so many different plans that I can't sit here on this social media app and teach you how to understand what exactly is covered. But I do have one piece of advice for you that can clear it up for you. And that is find yourself a dentist who sees many people in their retirement years and bring your plan to them. Let them have a little pre-exam gander into your mouth. Just kind of look around in there and ask them what you think their insurance will cover. Because the reason that I think you should do it that way is because anyone who sells you dental insurance does not really understand the intricacies of dental care, and they don't understand the options that you are going to have when it comes to choosing what kind of care you're going to enroll in and what kind of care you're going to say, you know what, maybe we'll do that in the future, or no, I don't want that at all. There are so many different ways to code things. There are so many different ways to decide, yes, I'm going to do this. No, I'm not. Your best bet, just like finding a car mechanic you trust, your best bet is to find a dental office where you feel comfortable. They treat a lot of people in their retirement years, and they are willing and able to talk to you about your new supplement.